what the thinking was, but I just say that for the record.
It was a story from North Carolina, and you're right about Louisiana. Rape and incest is not an exception, but the death of the mother would be an exception under Louisiana law.
Mr. Hickenlooper.
Thank you, Mr. Chair. And I'd like to start just for the record, I'd like to ask unanimous consent to enter into the record letters from board-certified physicians and the American College of Obstetricians and Gynecologists, ACOG, in Colorado.
Without objection.
Thank you all for being here. This is a hard issue, obviously, and the reason that we say that healthcare decisions should be between a woman and her doctor, or so many of us say that, is because so often these are deeply painful, challenging personal circumstances. Roughly 10 to 20% of clinically recognized pregnancies unfortunately end up in miscarriage. Mifepristone, along with misoprostol, are gold standard interventions to manage early pregnancy loss. And Dr. Verma, you've been through this. You have some experience of this. Are you worried that the constant attacks on this medication are going to leave millions of people who are losing a wanted pregnancy, but they'll be denied options? And you please tell your own story if you can.
Absolutely. We know, as I have said, that mifepristone combined with misoprostol for women that want medication management is the most effective treatment option. For many people in the country, that option is not available because of restrictions and bans on these medications. I was lucky when I had my experience to be in Massachusetts where I could access these medications, but for many people in the country, that's not the case. What we're seeing, for example, in Louisiana with the controlled substance laws is that people can't get either of these medications when they're experiencing miscarriages. And I also want to go back to one thing. I do want to thank both of you for recognizing, Senator Kane, Senator, that this is complicated. As a woman myself and someone who takes care of many women, in addition to people who don't identify as women, exchanges like the very polarized one that you saw really do a disservice to complexity and to people's lives. And I just wanted to say that I'm very happy to have these nuanced, productive conversations with anyone. I really do think that serves the American people better because this is complicated and we really need to honor that for our patients and for our fellow Americans.
Right. Well, and building on that, I want to reflect back on when I was governor in Colorado. We had got a grant for a 5-year, very ambitious statewide effort to vastly, as much as universally possible, but vastly expand long-acting reversible contraception to as many young women that wanted it. And over an 8-year period, we reduced unintended pregnancies by almost 60%. And so this is not only a major step forward to expand more access to all forms of reproductive care and reduce teen pregnancy and reduce, obviously, teen abortion, but it also saved $70 million over that whole process because so often those teenage pregnancies are not they don't get sufficient medical attention, and they end up with premature births, very expensive situations. How can comprehensive reproductive health, reproductive health care education and planning, such as what we did in Colorado, how can that help increase access for all women to their rights?
Thank you for that question. I absolutely support people having access to whatever birth control options are right for them, and having access to the full range of health care helps make people healthier. I think this also ties into a lot that we've heard about reproductive coercion. We've heard stories that are terrible. I've also seen many patients who can't access birth control, can't access abortion care, and ending end up having to stay in abusive relationships for that reason. I could tell you many stories, which is why the issue of reproductive coercion is so important to me. And I strongly believe that making sure healthcare, all healthcare, is more accessible to people is one of the solutions, in addition to figuring out how else we can better support people.
Thank you. And I'll leave us with the thought that, just last week, the Wyoming State Supreme Court found unconstitutional or their extreme bans on abortion law violated their own constitution because after the Affordable Care Act was passed, there was a statewide initiative to say that, they viewed that the Affordable Care Act as impinging on their right to decide their own health care. And now that has been reversed. Obviously, the sentiment has changed. And as the Wyoming State Supreme Court noted last week, the abortion bans do directly violate an individual person's ability to make their own decisions regarding their health. And I think that's a big issue here is whether people have that right to make their own decisions. I yield.